Good morning, everyone, and welcome to the Spring 2013 Representative Assembly. It's great to see so many people here early in the morning. So I've had a rewarding year as the SMA president, and I feel that we have moved forward as a profession. We've made progress in terms of recruitment and retention. We've maintained our good working relationship with the Ministry of Health, and we've worked on improving our relationship with regional health authorities. Although we have made progress in many areas, we still have a lot of work to do. One big item on our agenda this year is our fee-for-service and non-fee-for-service agreements with the Ministry of Health. We also have work to do on improving the leadership skills of physicians, which is the theme of this weekend's Representative Assembly. Saskatchewan's physicians are leaders within the healthcare system and within their communities. They are drivers of innovation. In an area when innovation and change are a focus of governments and other healthcare organizations, it's critical that physicians not only participate, but lead with vision and lead by example. If we don't, it will be the patients we serve who are not heard and the patients who will suffer the consequences. Let's go back to recruitment and retention. We now have approximately 2,040 physicians practicing in Saskatchewan. This is an increase of 13.3% over the 1,770 physicians we had in 2010. In spite of these gains, Saskatchewan remains behind the Canadian average of 209 doctors per 100,000 people, with only 181 per 100,000. We continue to face physician resource challenges in this rapidly growing province. Not only do we need more physicians, but we need to improve how physicians are distributed. Specifically, we need to recruit more physicians to rural Saskatchewan. Too often, overworked rural physicians are seeing patients from communities hundreds of kilometers away, and patients and physicians deserve better. The government of Saskatchewan has recognized this and is responding to the problem. While SaskDocs and the SIPA program have been recruiting physicians to the province, their efforts have still not met the demand. Recently, the government announced the new Rural Physician Incentive Program, which will provide $120,000 in funding over 5 years to recent medical graduates who establish practice in rural communities of 10,000 people or less. This will help recruit new doctors while also addressing the problem of retention. This is an ongoing issue because Saskatchewan has one of the highest turnover rates of physicians in the country. We keep only about half of our medical graduates. More has to be done, not only by the provincial government, but also by communities if we plan to reverse the trend of Saskatchewan being used as a launching pad for medical careers. The SMA is contributing to the recruitment and retention of Saskatchewan graduates through the Rural Roadmap program. Thanks to the Committee on Rural and Regional Practice, the Roadmap exposed 36 second-year students to rural and regional practices in the past year, while events were also held for upper-year students and residents. The retention of new physicians is critical to maintain our functional healthcare system in Saskatchewan. Our profession is aging as rapidly as the population of the province and the country. Currently, the average age of physicians in our province is 50, with over 32% being 55 or older. We need to see a workforce plan in place that will address the coming wave of retirements. We need to see a plan in place that will not only provide incentives to keep young physicians, but also provide physicians nearing retirement with hope that they will be able to retire and that their patients and communities will still receive the care they need. If we are going to retain our young physicians and engage them as the next leaders of the healthcare system, we have to do so in ways that speak to them and appeal to them. Unfortunately, the days when we would discuss issues in the doctor's lounge are not quite the same. Gone are the days when physicians would dutifully attend their RMA meetings and debate and discuss issues of importance within their regions and the province. The last thing we want as an association is for our way of doing business and conducting meetings to be a barrier to communicating with and ultimately retaining physicians. We expect our governments to adapt to changing demographics, and we must do the same. This does not mean abandoning the traditional way of doing things. There is still value and opportunity for collegiality in face-to-face meetings like this one. However, our meetings have to be supplemented by new ways of reaching young members and communicating with our entire membership. As I mentioned at the Fall RA, the trend today is towards less involvement in member-based organizations. This is not a new trend. It has been happening since the early 1990s and has meant the death of many organizations. The CMA has taken notice of this, and they're actually studying the effects of changing patterns of involvement in member-based organizations like ours. We have the opportunity for the SMA to buck this trend of declining involvement. But to do so, we must embrace new ways of communicating and new methods for conducting meetings. We can use the SMA as a forum for improving the quality of healthcare in our province. We are evolving into a model where we increase the number and quality of services we offer for our members. We are doing this not only to retain our members, but to better engage them. The SMA took the lead with the implementation of the electronic medical record program, and we saw a move this year to a service model for those physicians who have already moved to EMRs. The SMA is now working on a discount program for physicians, bringing even more value for your membership. Of course, negotiating fee-for-service and non-fee-for-service agreements for our members remains at the core of our organization, and we are focused on delivering new agreements in the near future. Dr. Guruswamy Sridhar will update you tomorrow on the progress we are making on our current fee-for-service negotiations. The SMA has put forward items in 7 major areas. We want to ensure the healthcare system responds to Saskatchewan's growing population and medical needs. There needs to be help offsetting rapidly rising overhead costs and increases in the cost of living for physicians. We are bringing forth items that will lead to better quality and improve patient access to care. We also need to stabilize the supply of physicians in Saskatchewan with an emphasis on rural areas. Appropriate care and collaborative care are 2 key areas being pursued in negotiations. We want to ensure that medical services are delivered appropriately and collaboratively under the patient-first approach. The SMA also wants to ensure that newer initiatives are structured through a consultative process and are implemented in a manner that is acceptable to physicians. This means talking to physicians before the initiatives are brought in, hearing our voices, and reflecting our concerns by adjusting new initiatives. When the voices of physicians are heard, patients benefit. When the voices of physicians are heard, nurses, therapists, educators, and everyone in the healthcare system also benefit. Saskatchewan's physicians have been pioneers in primary care and collaborative medicine, and we have developed a primary care framework that enhances access and accountability while promoting consultation and collaboration. We're promoting team-based care and ensuring that physicians are working to their optimum scope of practice. This includes shared care between family physicians and specialists, and the expansion of work performed by clinic staff under a collaborative model with a physician. The SMA is seeking to provide more and improved opportunities for physician engagement and promoting physician leadership. This includes recognition of lost income when physicians participate in health authority committee work and improvement initiatives. We are encouraging all physicians to seek opportunities to improve their leadership skills, whether that is through courses delivered through the Physician Management Institute, PMI, or certification programs such as the Canadian Certified Physician Executive Program. Leadership is not just about enhancing the working life of physicians, but is about helping to ensure the highest possible standard of patient care within an efficient and well-functioning system. Physicians are leaders within our practices and health regions and within our communities. We need more physicians to take advantage of opportunities to improve their leadership skills if we want a greater voice and be more influential within our regions and within the province as a whole. We're off to a good start. In 2012, 106 physicians attended PMI courses, and 5 physicians will be receiving their CCPE accreditation this month. The provincial leadership team started with 1 physician representative. We then moved to 3. We now have 6 physician representatives on the provincial leadership team. The Ministry of Health has recognized that physician input is required in healthcare transformation, and now it is our turn to move the quality agenda forward. You will hear from several physician leaders here today. Physicians who have taken it upon themselves to take a lead role in their profession. I challenge other physicians to do the same. Be a leader in your practice, in your community. Be a leader in your health region, your section, and at SMA events. There are so many reasons to work on your leadership skills. It will help you understand the importance of quality improvement. It will make you and those around you more accountable for your actions, and also invested in continual improvement. The more physician leaders we have, the stronger our profession is. The more physician leaders we have, the better our relationship will be with the Ministry of Health and the health regions. In the end, the more physician leaders we have, the better care we deliver to our patients. I have faith that most physicians will answer the call, and more are stepping forward every day as leaders. As a profession, I believe we are headed in the right direction. I see many people committed to serving their patients, creating closer ties with doctors, nurses, nurse practitioners, pharmacists, and other primary care providers. Building better relationships will benefit everybody. We have an enviable relationship in this province with our provincial government and Ministry of Health, and we have to continue to build on relationships with our health regions as well. We will never see eye to eye on everything, but as long as there are open lines of communication, an environment of mutual trust and respect, we can avoid the destructive situations we have seen recently in Ontario and Alberta, and are upcoming in New Brunswick as well. With that, I welcome you to the 2013 Spring Representative Assembly. It has been a rewarding year serving as your president. We have set the foundation for a strong organization that will be an advocate for physicians and a driver of change and innovation in the healthcare system. I am proud of the progress we have made in engaging our membership, particularly our young members. We need to continue this progress and encourage more physicians to give back and get involved in organizations like the SMA and other causes in their community. Thank you.